When cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, cancer, it's not prejudice. It strikes everyone. We've seen the racists with the big C. We've seen humanitarians struck down with the big C. But there are remedies, even if you've already had different measures of treatment, like prior chemo, surgery, or radiation that didn't work. Now, I'm telling you, there's a guy out there who is clearly the best at this. First tryout or second tryout, that's Dr. Gil Lederman. My personal experience in 1991 is he came up with a remedy for my dad. Others had passed on it or just couldn't figure it out. He was able to save my dad's life, and my family will always be grateful to him. But look, if you have newly diagnosed and recurrent cancers anywhere in the body, Gil Lederman's the guy to go to. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. So, to hit the cancer, you call 212-CHOICES and set up an appointment with Dr. Gil Lederman, 212-CHOICES. Or do it for someone that you know won't do it for themselves. He'll send you an informative booklet DVD in advance, and then you cop a squat with him at his offices at 38th and Broadway. Dr. Gil Lederman takes most insurances, Medicare, and Medicaid. Just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're talking about having a better life. A great article came in The Atlantic, a magazine this week, and it's entitled, Cancer Vaccine Exists, Goes Unused. Can you imagine that? There's a cancer vaccine exists, goes unused. It's an article by James Hamblin, and he writes, every 20 minutes a person in the United States is diagnosed with a human papilloma virus-associated cancer. Most of those cancers could be prevented with a vaccine. Now, who gets the vaccine? Well, the human papilloma virus is usually given to children. It's usually given to children about 11, 12 years of age. Now, people do get whooping cough vaccine. What percent? Well, about 86% of Americans get it. Now, if people got the vaccine for human papilloma virus, there'd be fewer cases of head and neck cancer. Right now, there's an epidemic of men who are getting head and neck cancer in numbers greater than ever before. There's many men and women getting human papilloma-related cancers in the pelvis, like cervix cancer. Almost all cervix cancer is related to human papilloma virus. Cancer of the penis, also in men, while rare, is related to human papilloma virus. Now, it's imagined that if the vaccination rates for human papilloma virus in the United States were the same as those in Rwanda, in Africa, this would prevent 50,000 girls today from getting cervix cancer in their lifetimes. Now, teenagers go to their doctors and they get vaccines, but unfortunately it's often not human papilloma virus. And the doctor, Dr. Anne Shachot, says it's a lost opportunity. The CDC, the Center for Disease Control, estimates that every time an 11 or 12-year-old was getting another vaccine, human papilloma virus vaccine could be given as well. The rate of vaccination would be 91% instead of 41%. Now, one of the top reasons for not getting human papillomavirus is, sad to say, it wasn't recommended to them by their doctor or their nurse. So people need to hear about it, and it's nothing that in my generation, maybe your generation, had available when we were growing up. But unfortunately, many people get human papillomavirus. It's usually spread from sexual activity, and obviously many parents don't want to talk about or think about sexual activity of 11 or 12-year-old and what's going to happen, but most likely that 11 or 12-year-old one day is going to have sexual relations and very likely get human papillomavirus, and once you get it, you can't get rid of it. Now, there's 14 million new human papillomavirus infections every year in the United States, and it usually happens in the teens and the 20s. So usually it's recommended the vaccine is given when someone's about 11 or 12. Why? Because the body's strong and it builds a strong immune response. And maybe if you're a parent or a grandparent, maybe you're 11 or 12 listening to the radio show this morning at 5:38, you can go to the doctor and get a vaccination for human papillomavirus and prevent or diminish the chance of cancer of the cervix, head and neck cancer, penis cancer, and others just by a vaccine. Wouldn't it be fantastic if we had a vaccine for every cancer? Wow. Well, let's think about using this one more since it's available, easy, and safe. We'll talk about skin cancer today because there's an epidemic going on, and actually we're going to talk about the Surgeon General issuing a report. But we had a man who came in. He had very extensive skin cancer elsewhere. They did big surgery on him, something called Mohs, M-O-H-S, Mohs surgery on him, where it's kind of like slicing the salami. They keep on slice until they don't see any cancer. Well, this man, they kept on slicing, and they ran out of salami, and they had to put a skin graft from his body on top of his head, and then they gave him standard radiation. So for a skin cancer, ended up with quite a scene of all the skin on the top of his head gone, and then a skin graft, and then radiation, so you can imagine. And now he's a very fair-complected man, and on top of his head, he probably had a lot of sun exposure there, probably didn't have a hat, and guess what? 2 more skin cancers. So I saw him about a month ago, and he came back just 2 days ago. I saw him. He saw his other doctors, the surgeons. Dermatologists are skin doctors who cut. The surgeons want to do more cutting. They want to do that Mohs surgery, M-O-H-S. He wants to come to us, and he's decided after he's investigated that we take his insurance, and by the way, we take most insurances, Medicare, Medicaid, that he wants our treatment, so he's going to have our treatment, and that's what we're going to do. We're going to do non-invasive treatment. We have a high success rate in the 90s, and we're treating lots of people with skin cancers now. We've talked about them the last few weeks. We treat melanoma, we treat Merkel cell, we treat basal cell, we treat squamous cells. So we treat lots of skin cancers, a lot of them around the head. Obviously, a lot of skin cancers around the eye, ear, nose, mouth, where surgery is especially deforming. And we treat a lot of skin cancers in the head area, eyes, ears, nose, mouth. We also treat them. We have another man coming who treated 4 spots on his hand at once, so he got 4-for-1 treatment. We have another man who has 4 basal cells we're treating simultaneously. He didn't have insurance. We gave him a price that was favorable to him, and he chose to proceed with treatment. Even though he didn't have any insurance or Medicare or Medicaid, we try to do the best we can for every patient whenever we can. And you can see his cancer is melting away with treatment. He had big basal cells, now gone. The man with Merkel cell, just spoke to him on the phone, his cancer is going away. So if you have skin cancers or suspicious lesions, you might want to come in and get checked out. There are other options besides surgery. If you don't have skin cancers, or even if you do have skin cancers, you might want to put on a hat and put on long-sleeve shirts and put on sunscreen. Even if you're going to the grocery to put on sunscreen, a lot of sun exposure is incidental, going to the car, going to the grocery. And most sun exposure actually is when we're less than 18 years of age. So if you have children, grandchildren, I want to talk about sun exposure, try to limit it, try to put on sunscreen, just put on the hands, put on the face if you're going out to sun-exposed areas, just on a routine basis, and you may eliminate or diminish a lot of skin cancers in the years and decades to come. And we have another man who came in from the opposite part of the body. He's a man, 67 years old. He has HIV. He's had HIV since 1986. So it's telling you how well the medicines are working for HIV, AIDS. He has anal cancer. He says that he's never had anal intercourse, if you're thinking about that. And he developed bleeding from his bottom. He had blood when he had a bowel movement, and then he had blood when he didn't have a bowel movement, just leak. And then he had a lot of pain. So what's that blood around the bowel movement called? Well, here's a medical word you might want to put in your dictionary: hematochezia. So he was worked up, and he actually presented with stage 4 anal cancer. It had spread to the liver. He was biopsy positive. He's come to us for treatment of the anal cancer, which we're going to treat, and most likely we will make that anal cancer go away. Anal cancer is very successfully treated with radiation, and we do focused radiation so we can focus more accurately on the cancer and try to avoid healthy tissues. So we want to eliminate his pain and his bleeding and the mass. And we've talked to him already about radiosurgery for liver metastasis, which have been documented. He has 2 large liver metastases. So we'd like to get him into remission, of course, and it's very likely we'll succeed. So this is a man, 67, with HIV since 86, now with anal cancer, with pain, bleeding. We want to take away the pain, take away the bleeding, get him in remission, and do the right thing. It's pretty good, right? By the way, if you have an interest in getting our booklet and DVD, you can call us during the week at 212-CHOICES, 212-CHOICES, which is our phone number, and it's choices because you have choices. We want you to reinforce that you have choices. You can call us at 212-CHOICES to get that booklet DVD. We send it to you at no charge. The number in numbers is 212-246-4237. 212-246-4237. We have some new voices talking about the work that we do, and we want you to hear these voices. My name is Dr. Lederman from Radiosurgery New York. We're an independent cancer treatment center in Manhattan. We're private, means we work for you. We don't take money from the drug companies. We don't take money from the surgeons. We work for you. You're our boss. You are the president of the United States of your body, and we work for you. That's how it is at Radiosurgery New York, a private cancer treatment center where we do take most insurances, Medicare, Medicaid. So if you have questions, give us a call. Here's the word from the voices, and we'll be right back.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you. With body radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman,